So for our group's presentation, we had human immunodeficiency virus, or HIV. My name's Emma DiGirolamo, and I'm going to be talking about the diagnosis, prevention, and treatment for HIV.
Hi, I'm Kennedy, and I'm doing the disease development of HIV.
Hi, I'm Kylie, and I will be doing the disease spread for HIV.
Hi, I'm Lauren, and I will be talking about pathogenesis and virulence factors of HIV.
And my name is Catherine Libby, and I will be doing the structure of the HIV virus. Again, here are all of our positions. So first start off with the organism structure. So the human immunodeficiency virus are approximately 100 nanometers in diameter. It has a lipid envelope in which are embedded the trimeric transmembrane glycoprotein GP41, to which the surface glycoprotein GP120 is attached. And you can see that on the right-hand side in the little diagram. These two viral proteins are responsible for attachment to the host cell and are encoded by the ENV gene of the viral RNA genome. Beneath the envelope is the matrix-bound P17, the core proteins P24 and P6, and the nucleocapsid protein P7. This is bound to the RNA, and they're all encoded by the viral GAG gene. Within the viral core lies two copies of positive sense viral RNA genome, i.e. it has a diploid RNA genome, together with protease, integrase, and reverse transcriptase enzymes. These three enzymes are encoded by the viral POL gene. There are several other proteins encoded for both HIV-1 and HIV-2 with various regulatory or immunomodulatory functions, including VIF, viral infectivity protein, VIRP, VPR, viral protein R, TAT, transactivator of transcription, REV, regulator of viral protein expression, and NEF, negative regulatory factor. An additional protein found in HIV but not HIV-2 is VPU, viral protein U. Similarly, VPX, viral protein X, is found in HIV-2 and not in HIV-1.
For pathogenesis and virulence factors, the portal of entry can be through a few different types of ways, which is demonstrated in the picture to the right. Some of these examples are through non-intact skin, if it was inoculated directly into the blood through needles or drug use or sharing syringes, unprotected sex, and through various mucous membranes throughout the body. How HIV adheres to the host is the HIV protein envelope binds to the CD4 host cell receptor, and when this binding happens, the host and viral cell fuse together, and that's when the infection starts. To continue on the pathogenesis, the process of replication of HIV is to the right. So HIV RNA, reverse transcriptase, and integrase enter the host cell when the virus and the host cell bind together. HIV viral DNA created through reverse transcription is the next step. Viral HIV DNA and integrase enter the nucleus to join the host DNA genome to come together. HIV RNA and proteins come together at the cell surface to mature and release a mature HIV virus. And this mature HIV virus will go on to infect other cells to repeat this process and further spread the disease. The portal of exit is transmitted by droplets. For virulence factors, we have reverse transcriptase, which is an enzyme. This enzyme creates DNA from an RNA template. We have integrase, which is an enzyme that integrates viral DNA with the host DNA. Glycoprotein 120, which is involved in the attachment and binding of the virus to the host cell. Glycoprotein 41, which allows for fusion and penetration between the virus and the host cell. And to the right is just an example of how HIV could spread throughout the body.
The disease development consists of 3 stages of HIV and several symptoms that are associated with the disease. The severity and variety depends on each individual person and what stage of the disease they are in. Stage 1 is an acute HIV infection. Within 2 to 4 weeks after being infected with HIV, about 2/3 of people will experience a flu-like illness. The symptoms include fever, rash, chills, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These symptoms can last anywhere from a few days to several weeks, yet some individuals do not have any symptoms at all during the first stage of HIV. Stage 2 is clinical latency or chronic HIV infection. In this stage, the virus still multiplies, but at very low levels. Without treatment, individuals can remain in this stage for 10 to 15 years. Yet if you take medication every day exactly as prescribed and keep an undetectable viral load, there is no risk of transmitting HIV. If the viral load is detectable, then HIV can be transmitted even with no symptoms. It is very important that individuals are seen by their healthcare provider regularly to get their viral load checked. Stage 3 is the progression to AIDS. If you have HIV or are not being treated for HIV, the virus will eventually weaken the body's immune system and progress to AIDS. This is the final stage of HIV infection. Symptoms of AIDS include rapid weight loss, recurring fever, unexplained tiredness, prolonged swelling of the lymph glands, pneumonia, or red, brown, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids. Many of the severe symptoms and illnesses of HIV disease come from opportunistic infections that occur because your body's immune system has been so severely damaged. HIV causes 2 types of cytopathic effects that were seen when studying HIV-infected human brains. The cytopathic effects include single cells undergoing irreversible cell membrane ballooning, rupture, and lysis, and multinucleated giant cells form via cell fusion involving the uninflicted CD4 molecule. Some long-term effects caused from HIV include cardiovascular disease, lung disease, certain cancers, liver disease including hepatitis B and hepatitis C, and HIV-associated neurocognitive disorders. Lastly, it has been found that the reason HIV is incapable of leaving the infected person's body is because cells infected with the virus fuse with helper T cells that then make very long-lasting memory cells.
For disease spread, the primary hosts of HIV are humans. It is not vector-borne, and vectors do not transmit this disease. HIV is found in human bodily fluids, and this is how a healthy person becomes infected. And it spreads through direct contact, through a mucous membrane, a damaged tissue such as an open wound, or the disease being injected directly into the bloodstream, which is a cause of using needles and syringes that are non-sterile, which are usually for drug use. And the bodily fluids that can carry HIV are blood, semen, preseminal fluid, vaginal fluids, rectal fluids, and breast milk. So if a mother of a newborn is breastfeeding and she is infected with HIV, she can spread the disease to her child through breastfeeding. And most commonly, HIV is transmitted through anal and vaginal sex, unprotected, sharing needles and syringes, mother to baby, which can be unborn and breastfeeding, and in rare cases, a contaminated blood transfusion or organ transplant. So if a person is receiving a blood transfusion or organ transplant, and it is unknown that the blood is contaminated with HIV, they can get that disease through that contaminated blood or organ transplant. And a person who contracts HIV may not know it for years, since symptoms don't always arise. And at that point, it can become chronic and can therefore lead to AIDS. And if a person already has a sexually transmitted disease, this can lead to a person being more at risk for HIV. And if a person with HIV has multiple partners that they have sexual intercourse with unprotected, that can spread the disease to multiple people, and that is dangerous.
First, for diagnosis in a clinical setting, there are a few different tests that are run to diagnose HIV. HIV is diagnosed by the use of an antigen or antibody test, which takes the blood from the vein of the individual and detects if there's HIV present. So first you have the basic antigen or antibody test, which is used to detect HIV 18 to 45 days after the exposure. For a more convenient and faster result, there's also a rapid test that can be done. This is done using the finger prick method, which can be done at home. And this yields results 18 to 90 days after the exposure. The last test that is often done is a nucleic acid test. However, this isn't as common as the other tests, as it tends to be more expensive. An NAT test detects for the actual presence of the HIV RNA in the blood and is used to detect HIV 10 to 33 days after the exposure. In the photo to the right, you can see the different result times and what each test measures for. So for the rapid test, it takes about 20 minutes. For the standard test, it takes about 5 to 10 days. The at-home test takes about 20 minutes to 1 day, and the NAT test takes about a few days. For HIV, there is a few measures that you can take to prevent yourself and your partners from contracting the virus. The first and most effective way is being abstinent or refraining from sex. However, if you are engaging in sexual activity, it is recommended that you use a condom to protect yourself and your partners from contracting HIV. Another way is getting routinely tested for STDs to keep you and your partners aware and safe. Never share needles with anyone, as they can carry viruses and diseases. If you are to use needles, however, ensure that they are completely sterile before injecting. The last prevention method that is used is called a PrEP, which is a medication that can be prescribed to people who are at high risk for contracting HIV and is known to be highly effective. Most insurance companies will cover the cost of PrEP for people who are at high risk, and you can find out if you're eligible for PrEP by consulting with your healthcare provider. For treatments, there is no known cure currently for HIV, but there are medications that can be taken to make HIV manageable. Medication for HIV is called antiretroviral therapy, or ART. The amount of HIV in the blood is called the viral load, as Kennedy discussed before, and ART acts to lessen the viral load. The treatments for HIV should begin immediately after diagnosis to be most effective. And as I mentioned before, there is currently no vaccine available for HIV. So here we have a few fun facts about HIV. So first, HSV1 and HSV2 can cause encephalitis in newborns when the mother is infected. HSLV1 related to HIV is known to cause cancer and depression of helper T cells with CD4 receptors by HIV. And then these are the references that we use. Thank you guys for listening.